Our next task is food poisoning scenario B. Food poisoning scenario B. In this particular case, you're an FY2 in a GP surgery. A 40-year-old woman has had a blood diarrhea for the past 2 weeks. 2 weeks ago, she had presented with diarrhea. She passes diarrhea 4 times a day. Okay, I'm just going to go back there. Passes diarrhea 4 times a day, 4 to 5 times. Yeah, 4 to 5 times a day. She also has got abdominal cramps. She has had abdominal cramps, which actually has gotten worse over the last 2 weeks. No change in the frequency of the diarrhea. So the diarrhea from 2 weeks ago until today, there's not been no change 4 to 5 times. Okay? And she has been having this for the past 2 weeks. But abdominal cramps have actually worsened. There's 2 samples taken 2 weeks ago, and it showed Campylobacter jejuni positive. Yeah? So let me just write that again. The Campylobacter jejuni positive, leukocyte positive, erythrocyte positive. What's the meaning of this? So there is blood in the stools. She lives with her husband and her 7-year-old daughter, but both the husband and 7-year-old daughter did not eat in the same place as her. So she ate in the KFC or any other restaurant where she ate on her own, but she works as a manager in that restaurant, whether it's a KFC or a different one. She works as a manager and she ate at work when the symptoms started. So no one at home, the husband or the child, has got diarrhea. She's able to tolerate fluid and she's not dehydrated. So we already have looked at the approach to gastroenteritis. So here we're just speaking specific about scenario B. Remember, there is a scenario A. You have to look at the scenario A because this is scenario B. So what is specific about this particular scenario? Okay. We'll discuss when we reach management. So what examination are going to do? Observations, abdominal, perectal examinations, or normal. Explain the diagnosis. It's already written in the task, campylobacteriosis or campylobacter infections. Okay, good. Management. Now, in this particular case, we're going to give antibiotics. Why? Because let's look at the indication of antibiotics. One is severe symptoms, high fever, blood in the stools, or more than 80 stools per day. High fever, blood in the stools, or more than 80 stools per day. We have to give antibiotics. Remember that. If a patient is immunocompromised, we give antibiotics. If the symptoms are worsening, we give antibiotics. If the diarrhea has lasted more than 1 week, we give antibiotics. Okay, so this patient of ours has a diarrhea for 2 weeks. This qualifies on this point. There's no improvement in the diarrhea, has been the same. Okay, and actually worsening. Why? Because the abdominal cramps are worsening. Diarrhea remains the same, but abdominal cramps worsening. So this point is positive. This point is positive. Is 2 weeks, and the criteria is more than 1 week. There is also blood in the stools. So we're going to give antibiotics. The antibiotics of choice, clarithromycin, not 50, it's 500 milligrams. So let's correct this one. 500 milligrams BD for 7 days. Okay, so this particular patient needs antibiotics because diarrhea has lasted more than 1 week and there is blood in the stools and the symptoms are worsening. Okay, what other point? Worsening abdominal pain, worsening abdominal cramps. Yeah, good. So they're the reasons why we need to give antibiotics to this patient. So other than antibiotics, what else we need to do? Prevention of spread. How she's going to prevent spreading? Do not go to work until the last episode of diarrhea, until 48 hours. Okay, until 48 hours. 48 hours with the last episode of diarrhea. 2 days after last diarrhea, okay, that's when you can go to work. Do not share towels. Wash your hands frequently, and the toilet seats after use. Yeah, so here frequently, meticulous washing, and of course after using it, washing the toilet seats, washing the handles, the door handles, the flushing point of the toilet. Yeah, rehydration, advised to take oral fluids. Offer the leaflets about Campylobacter infection, safety netting, and worsening symptoms, even on antibiotics, they need to come back. Thank you.